Hello everyone, welcome or welcome back to Sowkya Med Vision. In the last class, we have completed discussion of bones of upper limb, clavicle, scapula, humerus, radius and ulna. Today we are going to start the new topic pectoral region. We will discuss the muscles of pectoral region, the clavipectoral fascia, mammary gland which is very important in pectoral region. Yes, in this class we are going to discuss about muscles of pectoral region. There are four muscles in the pectoral region: pectoralis major, pectoralis minor, subclavius and serratus anterior. Yes. What is a pectoral region? First we have to know the pectoral region. It is the region presented anteriorly. Yes, it is a region presented anteriorly and laterally. It is presented anterolaterally in the thorax. Yes, in the front of thorax. So, pectoral region is anterior region in front of thorax. It containing major muscles connecting upper limb to the chest wall or thorax. And the main organ, breast, mammary gland. Yes, pectoral region, it is a region present anterolaterally of chest wall or thoracic wall. Now let's see the what are main parts of pectoral region. Yes, see, this part is known as pectoral region. Now what are involved in the formation of pectoral region connecting upper limb to the chest wall? See, this is the clavicle. Clavicle is a horizontal bone, beauty bone, yes, collar bone, containing two parts, medial part and the lateral part. The medial part is involved in the formation of sternoclavicular joint. Lateral part is involved in the formation of acromioclavicular joint. Yes, these are the ribs. These are the costal cartilage. Yes, blue color, the shaded blue color part is costal cartilage, and this represents nipple. And this is the humerus. The head of humerus is articulated with the glenoid cavity of the scapula forming shoulder joint. And this is the sternum, the bone presented in the anterior region of thorax. Yes, containing three parts: manubrium sterni, the first part; body of sternum, the second part; and the last part is tail. It is a xiphoid process. Yes. Let's see the muscles of pectoral region. As I said, there are four major muscles of pectoral region: pectoralis major, pectoralis minor, subclavius and the serratus anterior. Pectoralis major, it is a major muscle in the pectoralis region, hence major. There is another muscle, minor muscle. And now the pectoralis major containing two heads. We will discuss all these muscles in diagrammatic way, but here you have to listen first. Pectoralis major containing two heads, clavicular head and the sternal head. The clavicular head is originating from medial half of the clavicle. As I said, the clavicle containing lateral part and the medial part. So, the clavicular head of pectoralis major is originating. Pink color represents origin, whereas blue color represents insertion. In the previous class, I have said many times. So, the clavicular head of pectoralis major from medial half of the clavicle, whereas sternal head is from anterior surface of the sternum up to fifth costal cartilage. A sternal head is origin from anterior surface of the sternum from first to fifth costal cartilage. Yes, it is get inserted at lateral lip of bicipital groove. It is presented at the upper end of the bicipital groove is presented at the upper end of humerus containing two lips. Yes, lateral lip and the medial lip. Lateral lip gives insertion of pectoralis major. Yes, whereas the medial lip gives insertion of teres major. And the groove between these two lips gives the insertion of latissimus dorsi. Yes, now the pectoralis minor, which originates from the third, fourth and fifth ribs near the costal cartilage. The pectoralis minor's origin from third, fourth, fifth ribs near the costal cartilage, whereas it goes and inserted at the coracoid border, at the coracoid process of scapula. Yes, the pectoralis major from the third, fourth, fifth ribs near costal cartilage get inserted at the coracoid process of the scapula. Next, the subclavius. Subclavius means, in the last class I have said, clavius means the clavicle, sub means below the clavicle. So the muscle present below the clavicle is subclavius, extending from superior surface of first rib. Yes, superior surface of first rib to inserted its subclavian groove in the anterior surface of the clavicle. Yes. And another muscle, serratus anterior. There is another muscle, serratus posterior, presented posteriorly. Yes, this is the serratus anterior presented anteriorly. It is origin from upper 8 ribs and get inserted at the medial border of costal surface of scapula. In the last class, in the discussion of scapula, I have said that serratus anterior is inserted. Yes, it is inserted along the medial border in the costal surface from superior angle to the inferior angle with the digitations. Yes, let's see them in the picture, in the diagrammatic way. See, you also learn in diagrammatic way, it will be stored for long-term memory. Now let's see the pectoralis major. It is the major muscle and the largest muscle in the pectoralis region. Yes. Now let's see their origin. As I say, it has two origins. Origin of clavicular headed pectoralis major. See, this is the medial half, medial part of the clavicle, giving clavicular head origin. And this is the sternal head, anterior of sternum, and these are the costal origin. Yes, giving sternal head of pectoralis major. And now these pectoralis major together, the clavicular head and the sternal head together get inserted at the lateral lip of bicipital groove. Here will be the lateral lip of bicipital groove. So insertion of pectoralis major. And now let's see their action. The clavicular head of pectoralis major flexes the arm, yes, whereas the sternal head adducts and medially rotates the arm. And now pectoralis minor. It is a small triangular muscle deep to the pectoralis major. See, this is the pectoralis major and the small triangle muscle presented deep to the pectoralis major. And the pectoralis major action is flexes the arm. The pectoralis major action is flexes the arm and adducts and medially rotates the arm. The pectoralis minor, it is extending from 3rd, 4th, 5th ribs. These are 3rd, 4th, 5th near cartilage, costal cartilage. Extending from here and inserted at coracoid process of the scapula. Now the major action of pectoralis minor is assist serratus anterior in protraction of scapula for punching. See, this is the punching, right? We are pushing our hand forward towards away from our body for punching action. So this action is done by serratus anterior, which is assisted by pectoralis minor. Yes. Now these both pectoralis major and pectoralis minor are supplied by medial and lateral pectoral nerves. These are the nerves in the brachial plexus. We will discuss in future lecture. And let's see the serratus anterior. Serratus means what? Serratus meaning the digitations. Yes, the saw. Have you saw the saw containing digitations? So the serratus means digitations. Anterior, as I said, a serratus muscle presented posteriorly, naming serratus posterior. It is presented anteriorly, hence it is known as serratus anterior, presenting with 8 digitations. These 8 digitations are from upper 8 ribs. Yes, these digitations are from upper 8 ribs, and they are getting inserted at the first two digits are inserted at superior angle. There are 3 angles: superior, inferior and lateral angles of the scapula. So first 2 digits are inserted at superior angle of the scapula. Next 2 digits are inserted along the medial border. Along the medial border, that to costal surface. Costally. As I said, this will, if it is the scapula, this will be the costal and this will be the dorsum. So the costal surface along medial border gives the digitations insertion. And the lower 5 digitations get inserted at the inferior angle. Yes, let's see the action of serratus anterior. It is a boxer muscle. pushing the hand toward, pushing the upper limb toward for punching. Powerful protraction of the scapula. See, pushing forward is a protraction. And the serratus anterior is supplied by long thoracic nerve. Nerve to serratus anterior, again a branch of brachial plexus, major plexus in the upper arm. And now last muscle is subclavius. Yes, as I said, subclavius means presented below the clavicle, extending from superior surface of the first rib and inserted a subclavius groove presenting in the anterior surface of the clavicle. Yes, and subclavius, it is supplied by nerve to subclavius. It is supplied by nerve to subclavius nerve. And the action of subclavius means it pulls clavicle inferiorly. It stabilizes the clavicle. Rather, it doesn't extend the clavicle, but it stabilizes the clavicle, keeping in its position. It pulls the clavicle. Yes, this is the subclavius. This is complete discussion about the pectoral region, the major muscles in the pectoral region. If you have any doubts, please comment in the comment box. If you like the video, please do like, share and subscribe the channel. Thank you.